Hello everyone, this is Dr. Khan. I have a wonderful, pleasant patient from California. She's the one that I did the Facebook Live on. She's only 53, and when I saw my patient, I was very much surprised to see how severely affected she was with the BII, to the point where, I decided I wanted to go ahead and take a Facebook Live so that we could follow along and see how she has improved and how she is doing. So here she is on the first post-op visit. This is day number 4 for her. So if you could tell us, how do you feel and how your post-op course was?
How I feel now, I feel really, by the grace of God and from your miracle hands, I feel like a new person. Prior to me getting the explant, I was in pain like everywhere, like my neck, my shoulders, my arm, my back, my fingers, joint pain. I couldn't get out the bed. I needed help with everything, and it has just been a 360 turnaround for me. It has since the time that the implants have been removed, I will tell you that I just feel liberated. I feel so good. My body feels different. I no longer have the pain in my neck. I can sleep. I had insomnia. Now I can sleep better. What else? There's no pain. I can walk. I had so much trouble coming in here. It was so bad when I came initially for the operation, the surgery. I couldn't even walk in here. I couldn't stand. I couldn't sit. I had to come off the table. And right now is day 4. I would tell you guys, I want to give somebody hope, that just to know that when you get if you get it done right and get the right surgeon like Dr. Khan, he is a miracle worker. I feel like a totally different person. I'm no longer aching. My joints feel good. I don't have all the swelling in my hand. I can move my neck from side to side. I can get up. I can walk. I can go to the bathroom. And I will tell you, coming from a person that was hurting 24/7, and I'm talking from my legs, my knees, my hips, my forearms, my neck. I mean, I was in bad shape. There has been a 100% turnaround. So I feel awesome. I feel very good.
Now, I remember when I talked to you, you could barely even talk. You couldn't even get out of chair and sit on the exam table, so you had to be sitting on a regular chair. When I had to take the pictures against that black background, you couldn't even stand up straight. And what you mentioned to me, you had an instant burst of energy. That was how you described it very nicely, that many other patients have described. And this is a real problem with a real solution. And you essentially were bedridden. You couldn't do much.
Nothing. I couldn't do nothing.
Yeah. Your doctors had started you on Plaquenil, which is the hydroxychloroquine, very strong medication.
Yes.
And that was empirically started with no specific diagnosis in mind. So we'll see how you do. We'll continue to get your progress. How was your anesthesia experience?
Very good. I can tell you that I guess for me, wanting to get these implants out so bad, it wasn't really a concern for me. I just wanted them out, but my experience was great. The anesthesiologist was great. He talked to me. I don't remember anything. I just know I woke up and it was time to go. So I had a very good experience with it.
Sure. One thing I also want to mention is you actually took advantage of our nurse, Kim. She stayed with you for the first 24 hours like we mandate. You came in from California. You had, we all have busy lives of our family members.
Yes.
So you were able to basically get her how was her experience with you for the first 24 hours?
She was so awesome, very caring, very nurturing, taking care of my needs. She made sure that she was with me every step of the way. Just, very compassionate. And when you are caring for someone that is ill like that, it's not really, it's about helping, but you have to feel that person's pain. And she did that. She exceeded my expectations, just very caring, warm, and nurturing. And she made sure that my needs were met, and she just made sure that I needed everything that I needed. She gave me plus more. We prayed. We talked about some things, and she was just a very good person to have around after surgery for us to be strangers. I didn't even feel like we were strangers.
No, God bless you. Thank you so much for sharing your journey experience. This is where, the hallmark feature of breast implant illness is the joint arthritic pain, diffuse pain that the weakness, the lack of energy, all of that you came in and you truly exhibited that in the unfortunately the worst way. And it is amazing to see how you've bounced back just within, I would say, 96 hours. And you have an amazing recovery yet to go, and we'll continue to hear from you so that we can see you hopefully back to enjoying life for someone who's only 53.
Thank you.
Okay.
I appreciate it, and I hope I can give somebody else hope to know that I was probably one of the extreme cases where pain was an everyday part of my life. It wasn't just a headache. I had the brain fog. I had mostly probably 80% of the symptoms on the paper, but I'm just telling you from somebody that was in constant pain, constant. If you're thinking about it, you need to get this done. I'm telling you, the pain was real. I've had the surgery, and I can sit up here and tell you and look at you with a straight face and tell you I feel 100% better, 100%. So I hope I can give hope to somebody else to know that it does get greater later.
Sure, and I will end with this hope not only to the prospective patients, the significant others, the other doctors like the rheumatologists, and also last but not least, certainly the plastic surgeons who can say that this is a real problem with a real solution.
Oh,
right?
yes.
God bless you. Thank you.
Thank you.